Good morning, everybody. Welcome to a bright new day. I am Dr. Sri Lakshmi, a consultant obstetrician gynecologist from Lotus Hospitals, Lakadikapul. I specialize in high risk obstetrics, infertility, and menopause clinics. Now, we have gathered today to get information about breastfeeding, as August 1st to 7th is the breastfeeding week. What is the theme of breastfeeding? Do you all know? The theme of breastfeeding is enabling breastfeeding and making a better environment for working mothers. Now let us come to a basic question. What is breastfeeding? Breastfeeding is feeding as an infant or a young child with breast milk directly from the female breast, providing them with nutrients they need for healthy growth and development of that child. We all know that breastfed infants are healthy infants. Now, let us know a little about the breast tissue. It has got glands that make the milk, and it has got ducts through which the milk comes out. There are two basic hormones, which is prolactin, which stimulates the milk production, and oxytocin, which stimulates the milk ejection. Do you all know there are different kinds of breast milk as well? The first milk is the colostrum. That is the yellow thick milk which comes immediately within 1 week of delivery. It has many proteins which is rich in high proteins and immunoglobulins, antibodies and WBC. This milk is often neglected, said that it is not to be given to the child by old timers. But the first milk, that is a yellow milk, is rich, as we know it is rich in proteins. It has to be given to the child. The second one is called as a transitional milk that comes in the first 2 weeks and is very rich in immunoglobulins, low in protein, increased in fat and sugar content. Now there is also called as mature milk which comes after the transitional milk. It is thinner, but mothers who deliver pretermly, that is before the date of delivery, also have milk that is called as preterm milk, but it is rich in high quantity proteins, sodium, iron and immunoglobulins. See, there are so many different kinds of milk. Now, the main breastfed milk mother should know about two kinds of milk, that is called as foremilk and hindmilk. At the start of the feed, the foremilk is rich in proteins, sugar, vitamins and minerals that satisfies the thirst of the baby. The second one is the hind milk which comes at the end of the feed. It is richer in fat content, provides more energy and satisfaction that satisfies the hunger of the baby. So that is why when we advise the mothers, we advise them to feed the baby at one breast first, to empty one breast first and then shift the baby to the second breast. Because if you're feeding only for 5 to 10 minutes on one and shifting the baby to the second, the hunger of the baby is not satisfied. So let us know how do we prepare the mother for breastfeeding. First of all, the breastfeeding should be started, motivation should be started before delivery, before the birth of the baby. Mother should be told about the importance of the breastfeeding and select right place for delivery, wherein you have all kinds of support system from the doctors, nurses, and the hospital environment should be suitable for breastfeeding. Then avoid use of any unnecessary drugs in the preterm, in the prior to the delivery. Then initiate breastfeeding as soon as delivery. Even in cesarean sections, cesarean deliveries, they said that I have to breastfeed after 2 hours or 3 hours. No, immediately after the delivery of the baby, once the patient is on the bed from out of the theater, you should start latching the baby to the mother. Then always remember to give colostrum, that is the first yellow thick milk, and avoid any prelacteal feeds. Prelacteal feeds like honey, water or any holy water should not be given to the baby at all. And help the baby to latch properly so that it is able to suck at the mother's breast properly. Now there are different positions for feeding the baby. First, foremost is you should know that baby's head should be in line with the body of the mother. The whole body should be well supported. The baby is turned towards the mother and baby's abdomen touches the mother's abdomen. Now you can hold the baby in any position, that is in cradle position, football position, in lying down position, cross cradle position, whatever the mother is comfortable in. Now after all the breastfeeding is done, one very important thing to be noted is to burp the baby at least for 10 to 15 minutes, because if you don't burp the baby, there can be aspiration of the milk into the lungs and there can be sudden death syndromes. Now, what is effective breastfeeding? Effective breastfeeding is at least 8 to 12 times per day, and baby should have about 6 to 8 wet diapers. That means the baby is being fed fully. And an infant should also have a minimum of 3 to 4 movements, that is bowel movements in 24 hours. It should be soft and yellow. And the average weight gain of the baby should be around 15 to 30 grams if the baby is properly breastfed. And after the 10th day of life, baby regains the birth weight. These are all the important signs showing that the mother is breastfeeding the baby properly and the baby is also digesting that milk. Now, what are the advantages of breastfeeding for the mother and the child? Let us come to the little one first. So, it is a complete nutrition. It is unadulterated. Then there is a special enzyme called as lipase which helps in proper digestion. There are so many antibodies, immunoglobulins which prevent the baby against so many infections. Apart from that, the baby gets immunity towards the regular diarrheas, flu, and in the long run, they're less likely to develop obesity and less likely to develop any other generalized infections which you might get if you're not breastfed. Then what about the mother? What are the advantages of breastfeeding to mother? Advantages are, the first thing is it is convenient. You don't have to invest in bottles, then milk powders, then the mess of carrying so many things, sterilized water, place to mix the water, then cleaning of the bottles. It is available all the time. Then it burns more around 500 kilocalories, extra calories per day. So that in itself helps the mother to regain the shape back. It helps in losing weight along when paired along with healthy eating and healthy exercise. It helps in calming effect. It gives a calming effect to the mother, and it also decreases the inflammation and reduces the fluid accumulation which is caused during pregnancy. Now, what are the important things? One more important thing for the mother is it is a natural contraception. When the baby is breastfed, exclusively breastfed, that is without giving any top feeds, if the mother breastfeeds the baby exclusively only with her milk for a period of 6 months, it is a natural contraception. You don't have to use anything else for spacing your another child. Now, what are the important things to be done by the mother is to reduce your caffeine intake and to avoid alcohol. Because if you take more caffeine during breastfeeding, it is not properly digested by the baby and the baby's gut can be irritated. Now, what is the barriers? Why the mothers do not breastfeed? Why are the mothers not breastfeeding properly? Because there is lack of confidence in the mother. The belief that the mother sometimes has that maybe my milk is not sufficient, maybe I should top feed my baby so that it fills the stomach. Lack of adequate support system at home or at the hospital where she is delivered. History of previous breast surgeries. They think that I had a previous surgery, maybe I'm not producing sufficient milk. Then breast engorgement or cracked nipples or pain. All these might be the barriers for the breastfeeding. One should always know that once you have a support system at home and at the hospital is very important to encourage the mother to breastfeed. They should have a proper guidance on how much the milk she is produced and how much is sufficient for the baby. Now there are few issues, medical issues, which might cause difficulty in breastfeeding, like inverted or flat nipples, and then sore nipples, breast engorgement, and breast abscess. The problem of inverted and flat nipples is very commonly seen among many patients. So, these flat nipples or inverted nipples should be examined by the gynecologist or the obstetrician who is seeing the patient in her 9 months of time. These can be corrected before delivery by simple procedures and simple exercises, which helps in breastfeeding the delivered baby better. Sore nipples are also common and they are usually done because of excessive cleaning of the nipples before and after feeds. We advise patients not to clean the nipples very frequently with water because it can cause fungal infections and can cause pain in the nipples. Breast engorgement occurs when the mother is not feeding the child for a longer time. The milk accumulates and started causing pressure and also pain in the breast. This further not taken care of leads to breast abscess which needs surgical intervention. Now coming to a very common question, who should not breastfeed? Are there any conditions where you are not supposed to breastfeed? Yes, there are contraindications, absolute contraindications where the mother should not breastfeed, like HIV infections, active tuberculosis, herpes lesions on the mother's breast, infant with inborn errors of metabolism, phenylketonuria should not be breastfed. Mothers on certain medications like anti-cancer therapy and radioactive isotopes. Feeding is withheld for the period of the medication and can be restarted after the medication is stopped. Coming to our main theme, that is providing a better care, enabling the breastfeeding for working mothers. How to do it? Working mothers should, any mother should exclusively breastfeed for a period of 6 months. And after 6 months, the baby should be allowed soft diet, soft foods along with breastfeeding up to a period of 1 to 1.5 years. That improves the growth of the baby and also prevents it from many other infections. Now, the working mothers, according to the government, where there are more than 50 members, each working space should have a creche, a place, a clean, healthy place for the mothers to breastfeed and people to take care of the children. What working mothers can do is working mothers can breast pump their milk and store the milk so that the baby can be breastfed later whenever in need if she is not able to carry the child to the working place. How do you store the breast milk? Breast milk can be stored at room temperature at 25 degrees centigrade for 6 to 8 hours. Same thing if it is in an insulated thermal pack with ice packs, it can be stored up to 24 hours. Now in a freezer up to F minus 15 degrees, it can be stored for 2 weeks. The same thing in a freezer with minus 18 degrees, it can be stored up to 3 to 6 months. Then a deep freezer of minus 20 degrees, it can be stored up to 6 to 12 months. So, for the working mothers, we advise always use a breast pump to pump out your milk and to feed your child with the help of a bottle, with the help of any person help at home, or if you can carry your child to the workplace, please feed, breast pump and feed the milk to the child or directly breastfeed the milk. Now, the common question is how many times should the mother feed the milk? We advise demand feeding. Whenever the child is hungry, it is supposed to be fed. that comes to around 8 to uh, 12 times, more than 8 to 12 times a day. And how do you know that it is full? The mother can feel the sucking and swallowing reflex of the child, and when the breast is empty, usually the baby is full. Now, with all these, uh, now we also have breast milk banks where the mothers can store the milk and help the other children also. Other children who cannot feed on their mothers also help in breastfeeding. Now, another new coming up topic is surrogacy. How do the mothers who are having a child with surrogacy feed their newborn? We have come up with a new medications. There are different medications where the mother who is receiving the child from the surrogate can be prepared to give milk before, from around 4 to 6 months before, ahead of the delivery of the surrogate. The mother who is receiving the child can be prepared to breastfeed her child. So, giving all these, we encourage all mothers to breastfeed her children, or breastfeed the newborn, and also know the advantages and disadvantages of the breastfeeding and disadvantages of the top feed for the baby. We advise the mothers to exclusively breastfeed for a period of 6 months and also continue breastfeed along with the soft diet from 6 months age to at least 1 to 1.5 years of age. That will help the newborn to become a healthy child, healthy individual when he grows up. So, any doubts or anything, you can contact us to book an appointment on the following numbers at Lotus Hospital. Thank you.